Good morning, everybody. I wanted to take some time to continue discussions about non-invasive PGTA. One of the really interesting things that is continuing to be shown to be true is that embryo biopsies are really not the gold standard for looking at the ploidy status of embryos. In reality, the gold standard is the whole embryo. But it's impossible if you're screening actual embryos to check the ploidy status and that you would actually find embryos that you would transfer. Obviously, it's impossible to utilize the whole embryo to screen that embryo's health. So we've used biopsies up to this point because it's the closest representation that we can get. It's the closest way to look at the ploidy status of the embryo. But it's not the gold standard, primarily because of Mosaicism. And Mosaicism is a real thing. It's a challenge that embryologists, that clinicians, that laboratories face when trying to choose healthy embryos. Because, as I've talked about in other videos, Mosaicism causes cells to be different. And if you're biopsying cells from an embryo, and those cells are different than the rest of the embryo, you're not going to get a true picture of the embryo. You could end up getting a false positive, you could end up getting a false negative, and ultimately that embryo may not end up leading to a pregnancy or, more importantly, a baby because of Mosaicism. So looking at the whole embryo obviously would be the technical gold standard, because that would give you the ability to know what the real ploidy status of that embryo is. That's exactly why we have developed a non-invasive PGTA and why so many laboratories and clinics in the world are moving to that technology. Not just because it's a safer and better methodology to use by using the DNA and the culture media, but also because it has a higher concordance with the whole embryo. And that's what we've actually been able to show in our validation data, that we have approximately an 80% concordance with biopsies. But the primary reason that the concordance with biopsies is low is because of Mosaicism. However, through validations, when we do concordant studies by comparing the DNA and the culture media with the whole embryo, we have 98% concordance with the whole embryo, both on the ploidy status and the gender. And I think that really is absolutely incredible, because it shows that the DNA and the culture media is in fact representative of the whole embryo. And in essence, the culture media, or the non-invasive PGTA, is closer to what the gold standard is. And I would submit that this will become the gold standard for PGTA testing, because we have been able to demonstrate that there is a lower concordance between the biopsy and the whole embryo than the culture media and the whole embryo. So it's a perfect time to be moving forward to non-invasive PGTA, especially as this problem of Mosaicism continues to be discussed. And last night I was part of the payers meeting in Philadelphia, and Dr. Jamie Griffo talked about Mosaicism and talked about transferring mosaic embryos, and it was a fascinating presentation on the importance of screening embryos and the importance of choosing embryos for transfer at the right time. And I really am excited to be part of this conversation and the development of new technologies to ultimately help IVF doctors find more healthy embryos and ultimately to help patients have more babies. So thank you for tuning in this morning, and I look forward to talking to you again soon.